My name is Professor Peter Fonagy, and I'm Chief Executive of the Anna Freud Center. I'd like to warmly welcome you to this, the third of our 5-step seminar series, this time on supporting staff. Before I start, I'd just like to say a few words about the Anna Freud Center. Our aim is to help transform the experience of children, young people, and the families with mental health issues. We do this by carrying out research to improve understanding of mental health and resilience, evaluating and improving the treatments and services children and families are offered. We use our research to develop tools and services that support children, young people and their families, and organizations that work with them. We translate our research wherever possible into practice. And finally, we take a leading role in the development of policy and practice in the UK and perhaps beyond to ensure that it is built on evidence, tested experience, and has the input of children, young people, and their families. Before I introduce this seminar, I'd just like to say a few words about the challenging situations that schools and colleges find themselves in at the moment. Last year must have been, without doubt, one of the most difficult in the history of education. And just as we thought it couldn't get worse, we've seen another major spike in COVID, resulting in another lockdown and, of course, school closures. So I want to start the seminar by expressing my personal admiration for all of you here today and for what you've done in extraordinary circumstances to keep the education of our children growing, supporting their mental health while redesigning your teaching methods at the same time. It's an incredible feat which speaks volumes about your profession, to your individual creativity as educators, and your dedication and commitment to the children and young people you teach. Even before the pandemic, teaching has been well established as a very stressful job. When I say we, I really mean Jamie Smith, our brilliant director of the Centre School Division. When we put our 5 steps program together, we wanted to put staff mental health and well-being at the heart of it, on the basis that unless we look after school and college staff, we won't be able to look after our pupils. For far too long, the well-being of school and college staff has been ignored. Organizations like Education Support and a few others have been ploughing a lone furrow. At the Anna Freud Center, this is something we have also been addressing, and we hope that with your support and contribution today, we will offer some insights into how we can support staff well-being in education better. But I also want to say a little bit about what we won't be covering today. We won't be talking specifically about the current lockdown and the crisis. We won't be talking about the current government's lockdown policy. There are other experts who are perhaps better equipped than us to comment on these. Our aim with our 5 steps framework is to help schools and colleges to build a holistic system approach to mental health and well-being. We believe by doing this, schools can, over time, help create a kinder culture which values and respects staff in schools and colleges, and provides them with the tools and the support they absolutely need. In this way, we hope that we can be part of a movement to extend further support to staff, improve retention, improve conditions, and in doing so benefit children and young people as well as those who teach them. So what's the 5-step framework? And what are we doing today? Well, we know that schools and colleges are keen to develop whole school and college approaches to mental health and well-being. But we also know that this is a massive task, and while there is a lot of advice around, it can be very hard to know where to turn to. Our 5 steps framework has been designed by mental health experts and teachers to provide a simple way to develop a whole school approach. It's evidence-based, it's free, and it's interactive. And all you have to do is log on, follow the steps, and find out what approach is best to apply to your work. The 5 steps are leading change, working together, understanding needs, promoting well-being, and supporting staff. There isn't a framework which tells schools and colleges what to do. We've created this in a spirit of collaboration in which we can offer expertise in mental health and share it with schools and colleges who are doing such an excellent job in embracing and adapting to their own settings. It's been created by mental health experts and teachers together. So we've done our best to bring the 2 disciplines into alignment for mutual benefit, and of course for the benefit of the children and young people. This is the 3rd of our 5 seminars. We run our seminars every half term, and each one focuses on one of the 5 steps, as you might expect. I hope after this one, you will feel inspired to join our future seminars. Our next one is on promoting well-being and will take place on the 4th of March. At the Anna Freud Center, one of our key principles is collaboration. We are privileged to have our speakers join us today, but we would especially like to thank you, our participants, for joining us. It's only by working together and combining our individual and collective skills and knowledge that we can achieve change. We are inviting questions throughout, which we'll discuss at the end. You can do this by posting on the Q&A tab at the bottom of the screen. At the end of this talk, we will ask you to fill in an evaluation form about the seminar. If you're tweeting, we are on @EFNCCF, and please tag us and use the 5-step hashtag. In these seminars, we try to bring together research and practice. So our shared learning can be both informed and applied. The format of today is that in a minute, I will introduce our first speaker, Sinéad Mc Brearty, Chief Executive of Education Support, an organization that does so much invaluable research in this field. Conny Brandt from Peterhouse Schools in Southport will give a presentation on the benefits of staff surveys. Finally, my colleague, the Anna Freud Center's own Lesley will be speaking about our Tri-Space service for schools and how using simple therapeutic techniques can help support school and college staff. So, let me stop sharing my screen and introduce Sinéad to you. I'm delighted to introduce her. She's Chief Executive of Education Support, the UK's only charity providing mental health and wellbeing support services across primary, secondary and tertiary education sector. Many of you will know her work and how the charity supports individuals in crisis, helps to improve workspace culture and advocates for change within the education system. Sinead spent the first half of her life at KPMG Financial Services Business Unit. She moved to the non-profit sector as Deputy Chief Executive at Social Enterprise London, and subsequently as Director at the award-winning social enterprise Women Like Us. Before joining Education Support, Sinead worked as an organizational development consultant with Systemic Coaching Partners and was visiting lecturer at Imperial College London and the Royal College of Art. Sinead says she used to have hobbies, but now has young children instead. She is, though, a governor at a South London primary school. But what I want to stress is that under her leadership, Education Support has gone from strength to strength. There could be no better time than now to have a powerful, passionate and determined advocate to work and support education staff. We are very privileged to have her here to share her learning and research into the support needs of school and college staff with us. Sinead, over to you.
Thank you, Peter, for that very kind introduction. And hello to all of you who are have made it into the room. Here we are, and it's Thursday in what feels like a very long week, but we all made it, and that's a good thing. And of course you would be here. Of course you all would have turned up for an opportunity to learn about the 5 steps to mental health and well-being, because you know what we find across the sector is the engagement of professionals in this topic is immense. So thank you for taking the time and making the time today. Education Support is a charity. We've been in this business for 144 years, working on educator well-being, and our mission is to improve the mental health and well-being of the education workforce. We do that because we believe well-being and mental health leads to better education. So many thanks to Peter and Jamie and colleagues at the Anna Freud Centre for inviting us to participate. My job is to speak to you about the context around staff well-being, to explain a little bit about that. And I will then, I suppose, talk a little bit about what we might do and what some of the strategies are that we might be able to adopt to improve staff well-being. In terms of COVID, as Peter mentioned, I'll be touching on this, but today is focused on well-being in the round rather than specifically on COVID. However, it is of course relevant, and I will mention it here as well. I'm going to start by referring to our major piece of research that we conduct each year. We have a substantial sample each year of over 3,000 teachers, and we produce a report called the Teacher Wellbeing Index. So 2020 was the 4th time we've run this survey, and I will be drawing out some of the learning from that now quickly. I will say I'm not going to use charts and data. I know you would love me to sit here with a lot of really detailed Excel charts, but I'm sorry for those of you that I'll be disappointing when I say I'm not going to do that. I'm going to stick to the headlines and stay quite high level. But there are links on the slides, and the slides will be shared with you by colleagues after this event. And those links will take you to very dense research reports. So those of you who like the data will be able to get up to your elbows in it. You'll be pleased to know. So we are talking about the context of staff well-being, and I thought I'd start with a really cheery slide. Maybe this was how I was feeling on Tuesday when our lockdown was announced. I'm happy to report I'm recovering somewhat and perhaps surfing on the top more than drowning below. But what our research around staff wellbeing over the last 5 years actually has indicated is that stress levels are incredibly high. There's no shock there to any of you. They've been very high over the last 4 years, and we saw a massive spike again in October, and I suspect we're seeing one right now across the profession. But outside of COVID, stress has been very high in the profession for some years. We've also seen increasingly over the last 4 years increases in the symptoms of poor well-being. We know that mental health support varies between schools and colleges in terms of what's available to staff in different places. And this is related to barriers that then affect people when they reach out for help. We have almost 60% of people in the workforce saying that they would not feel confident disclosing unmanageable stress or a mental health issue to their employer. And about a third of those who are reporting that would say that's down to a sense of stigma. So we still have work to do here around normalizing mental health among the professionals in our schools and colleges. And the last kind of key learning from this year's report is around the well-being of the workforce. And education professionals have a lower well-being score than the general population, which is obviously something that we would all like to see increased. I'm going to look at why staff leave, not because I want to dwell on that. We all know, 1 in 3 qualified teachers leave the profession within the first 5 years. We have a lot of senior leaders who are looking at early retirement currently. We know this from colleagues in the union sector. But what's important is, I think, what it tells us about the well-being issues that staff experience in the sector. In our surveys, we ask them about why, if they're thinking of leaving, why are you thinking of leaving? And the responses people give us is that their drivers for considering leaving are around the volume of workload, not feeling valued, work-life balance, unnecessary paperwork, so bureaucracy, the target-driven culture that we see in the sector, unreasonable demands from managers, and the lack of resources in schools and colleges. None of these issues looks like it will go away anytime in the near future. So there are going to be strategies that we want to adopt in order to address the impact that makes on staff. I said I'd touch on COVID. We published a report called COVID in the Classroom, also available on our website in September. And in this, we were harnessing learning from the first lockdown. So it's a big shock to everyone, but we found that the first lockdown had a negative impact on the mental health and well-being of the workforce. Appreciation was a really important point, and there's good news here. Teachers, teaching assistants, support staff, lecturers, people working in education felt appreciated by their colleagues and felt appreciated by senior leaders at very high levels. And this is important because it builds and supports people's sense of motivation and engagement, and actually it helps build our resilience. It helps get us through at these times. So that's a big, pat on the back for the profession, that people are looking out for each other, looking after each other, and the relational quality of educators has come to the fore to help people get through. We've also seen the challenges that were reported the first time around. The top ones were around how do you know that students and pupils are able to complete work? Government guidance changes at a pace and clearly makes life very difficult. And obviously workload is high across the piece. There are a lot of classroom teachers right now who are trying to be on site for staff as well as get things, resources online. So the workload is across the piece, but we have seen and been particularly concerned about senior leaders across this time frame because they really haven't had very much of a break at all. In terms of support, staff identified after the first lockdown, education staff talked about the need for clarity on health and safety, for learning priorities, clarity about assessment, and guidance and support around how to support pupil mental health. This was what we published in September. We could be publishing it today. The issues are pretty much the same from what we hear from educators across the land. I think it's also worth noting that this week, one of the big unions produced some analysis of local data across 3 boroughs that showed COVID prevalence rates for school staff at 4 times higher than the general population. There obviously needs to be further research into that, but I think it speaks to the health and safety anxiety that remains the key thing that we're hearing back from educators in schools right now through the various ways that we're in communication with them. But we also have issues around the pressure for on-site provision, the lack of laptops, and there's basically going to be a lot more pressure on school sites during this lockdown. And of course, people are more thinly spread because we've got high levels of staff absence as well. So where COVID is relevant to this conversation is the pandemic compounds what is an underlying existing strain in the system. And that's important for us to continue to speak to policymakers and to lobby and advocate actually for them to make some different decisions. So that's something that we do in the course of our work, and I'll touch on at the end. So what do we do about all of this? Because it's not a pretty picture. There's not a whole heap of good news here. There's certainly not as much as I'd like to have to share with you. Well, in terms of staff well-being, we basically take the view that for each member of staff, well-being is best addressed at the intersection between three elements. One is the individual, the second is the workplace, and then the system. And these three levels interact and play a critical role in well-being. So we can use one of these levers to address elements of well-being, but actually where we would make significant progress is the interplay between the three, and when we can align those three elements of the system to be headed in the same direction to support staff well-being. I'll touch very briefly on the system. It's the easiest one to talk about, funny enough. To point the finger at government is very, I could be here all day, but I won't. The key point is schools don't operate in a vacuum. And so policymakers have a very profound effect on staff well-being, and that matters. Whilst we can do tremendous work at the level of the workplace and with individuals, the wider context that policymakers set really does matter. There are three big topics that I raise with government when I have the opportunity. One is accountability pressure. We need to be able to build an accountability system that supports teacher efficacy and development instead of producing, well, really it's unproductive tension and anxiety, often the result of accountability currently. Issues of professional identity and trust are important. We need to be able to ensure that staff feel valued and that they have autonomy to do what they feel is right in their schools and in their classrooms, that they're involved in decision making. We can correlate this back in the data with things that cause stress and strain on educators when they don't feel that they have any agency in decision making on policies that affect them. And obviously workload. Overwork has become quite normalized in the education sector. And so we've got a shift to do beyond having task forces to normalize better, healthier working practices for everyone. So at the system level, those are some chunky things that would make a big difference to educator well-being. If there are other big things that you think matter, drop me a line. My contact details will be here at the end of the presentation. On the workplace front, and this is really where the focus of the 5 steps and part of, I suppose, what I should spend a bit more time on today, there are some really key elements at the institutional level that make a difference to staff in schools. And this is really not one size fits all, but obviously having a strategy, clarity about what the school values and what it wants to achieve in terms of well-being. Leadership, leaders are so important in terms of setting the tone, role modeling, well-being, and normalizing mental health conversations, normalizing seeking help, and also just demonstrating compassion and empathy. These are really, really important aspects of leadership that will support staff well-being far more than some other more slightly gimmicky well-being agenda items might achieve. And also this builds resilience, which of course at the moment is hugely important. From a culture perspective, teachers thrive in collegiate environments, and collegiality, with lots of evidence in the literature, builds protective resilience. So it supports teachers to stay well, and relationships are quite key to their well-being. This isn't a surprise. We're talking about the education system. So culturally, finding ways to foster collegiality become very, very important in an educational workplace. As well as, the things I just touched on, not allowing overworking to become normalized, making sure that there's effective communication, that people have an opportunity to voice their thoughts, to participate in decision making, to share, and to put that alongside some targeted professional development some fair expectations, and well-trained line managers. And I'll touch on line management again in a moment. But these are the kinds of cultures that best support staff well-being in our schools and colleges. And then just to mention self-efficacy as well. Core to the well-being of our professionals in schools is the sense that they can make a difference, that they can effectively help children to learn and achieve. So all of the stuff around workload, when we task our educators with workload that is bureaucratic and maybe more oriented to data and so on, it demoralizes them, it makes them feel like they're not making a difference in the lives of the children that actually they are motivated to come to work and support. So where we can help our staff to do work that more directly speaks to their sense of making a difference, this has a very positive effect on their resilience and on their well-being overall. So that's a kind of quite a difficult one in some ways for schools historically, with some of the requirements from the system. But actually, one of the great things we've seen during the pandemic is that the requirement on teachers has been stripped right back to the core of teaching and learning and relating with children and maintaining relationships. And actually, in that space, our professionals are very happy. All of the workforce in schools respond very positively to this stripping back of unnecessary additions that have come into the role over time. So there's an opportunity to sustain that, I think, after the pandemic, and that's a real positive for us to take away. There's lots of other tools that can be useful to you in school workplaces, whether it's staff survey tools, risk assessments, but also access to counselling. But there's a level of knowledge that we should be sharing across our workplaces in terms of mental health awareness and being able to communicate and give good feedback and line management, and all that stuff plays into positive well-being for staff. Line management, I've got a slide to illustrate in just a second, but it's hard to overstate the importance of line management for individuals in terms of their experience of work. And in this context right now with COVID, it can be very difficult to stay in touch with how that's working for people. So you can have some quite poor relationships that are not visible because we're not around each other in the same way as normal. So for those of us who have management responsibility or leadership responsibility, it's actually really important more than ever now to check in and make sure that line management relationships are working well enough. Whether you do this through surveys or 360-degree feedback or whatever, I would suggest this is something to pay some attention to right now. Workload, as I said, the type of work matters, and there's some positives right now that we can draw to people's attention. Autonomy is very connected to our sense of well-being. If we have a very high level of demand placed on us and a very low degree of control, that's not positive, it's not motivating. Nobody does well in that. So we've seen a lot of schools in this crisis increase the autonomy that's been given to the workforce. They may not be able to reduce the demand, but where people have more autonomy, so for example, if I'm working in a school, but my own children are at home and I'm trying to work through how I record my lessons and mark and so on and so forth, the more autonomy I have to do that and sort out my own working life, the happier I'm going to be. It's a bit of a no-brainer. And we've also seen horror stories of very top-down, highly pressurized surveillance, really, in the workplace. And this is clearly quite contrary to anyone's well-being. We also need to pay attention to the emotional content of the role. There are a lot of different people in our schools who are carrying quite a lot, and we need to pay attention to that and make sure they have the right support. I'm going to rattle through here because I think I need to finish quite quickly. So just to say about this point about line management, there's some interesting research. It's cited down here, Global Happiness Report, but it tells us that life satisfaction is significantly driven by job satisfaction. Almost a quarter, if you like, of your life satisfaction is tied up with your job satisfaction. And job satisfaction is driven significantly by interpersonal relationships at work. So that matters a lot. And when we break down what people are talking about in terms of interpersonal relationships, almost all of that, 86% of what people are referring to in that is relationships with management. So we take away from this that line management can have a very significant impact on somebody's general well-being outside of the workplace, and clearly very significantly so inside the workplace. So this comes back to where I think some of our management practice needs to be looked at and thought about in this context. Just a word about self-care. For those of you who are here, you are probably, I will generalize and say you're probably quite a caring bunch. You probably spend a lot of time thinking about your pupils and students and perhaps staff and colleagues, but you'll be very oriented to others. And you may not be so brilliant at the self-care element. Certainly a lot of the people can easily overlook themselves and even feel that self-care is an indulgence, that they're not, they actually, all of their energy should be put into others. And so I just want to remind you of what you already know, that it is not selfish to look after yourself, and that by caring for yourself, you're investing in your own ability to stay strong in this academic year. As I often say to teachers, you're like elite athletes in the field of relationships, and your conditioning is dependent on your health, physical, emotional, mental, and spiritual, and whether that's religious or it speaks to your sense of purpose. There's lots of stuff you cannot affect that's well out of your control right now, but you can take yourself seriously and you can look after yourself, and that will matter. That is incredibly meaningful right now. I could go on for days, but I won't. Education support, we do loads of things. We have a free helpline. We give away grants to people in distress. We have services for schools and colleges, and we obviously research and advocate for improvement. You can find out all about that on our website. And I would just draw your attention to this helpline. The 08000 number is available 24 hours a day. You can access, anyone working in education can access free counselling through that helpline number. It's confidential. And as I say, it's free and independent. So please do share that with people in your schools and colleges. I should probably stop there, I think, and hand back to Peter. Just as I do, I think the one thing I'd like to say is thank you to all of you who are here. As a parent, as well as somebody working adjacent to you in schools, I'm genuinely humbled by your commitment and purposefulness, and actually the love and compassion that you've shown to families up and down the country. It really is inspiring. So thank you for all that you do. Take care.
And Sinead, that was fantastic. Thank you for that brilliant overview. And we'll hear more from you a bit later in answer to the questions. I have a few of my own, but let's now move over to give the floor to Conny Brandt. Our next speaker, Conny Brandt, is from Peterhouse School in Southport. Peterhouse is an Ofsted judged outstanding non-maintained specialist school for children and young people aged 5 to 19 who have a diagnosis of autism spectrum condition. We first met Conny at a Schools in Mind seminar in Liverpool, where she told us about her work on promoting staff well-being through developing staff well-being surveys. What has been so impressive about her work is how she has developed from a simple survey a tool for systemic change, which has achieved very clear results. Conny has really embraced staff well-being, a subject that has always been close to her heart, and the results have been literally transformative. We ourselves use Conny's experience in our 10-step towards school staff well-being resource as an example of best practice. And it's really a delight that she can this afternoon share her learning in a more in-depth way with everyone here today. So Conny, over to you.
Thank you, Peter. So I'm the School Business Manager at Peterhouse School. I've been at the school for a very long time, but I've been the business manager since January 2016. I come from an admin background, so I'm not a wellbeing professional. I'm just somebody with a passion for the subject, and I'm fortunate to be in a position where I can actually utilize that. And I'm also quite active on Twitter if you want to come and look for me. Peterhouse, as Peter said, is a special school for autistic children and young people. We're quite a small school with up to 64 pupils. It's a non-maintained school run by a registered charity called Autism Initiatives. We've been around since 1974. Wellbeing started being an issue for us about 5 to 10 years ago, when the nature of referrals changed to more older pupils with more complex needs, mental health issues, and this resulted in a lot of additional pressures on staff. And we've always been very good at adapting a provision to meet the pupil needs, but we haven't always been good at adapting provision to meet the needs of staff. So in 2016, we realized that staff morale was quite low, and we had a significant level of absence due to work-related stress. So we decided to start a wellbeing project, and we did this with Time to Change. Now, Time to Change's funding is actually running out at the end of March this year, so they'll no longer be around, which is a shame because we found them really helpful. They helped us put together an action plan. They helped us form a wellbeing team with staff from different groups and different teams in the school. They gave us a lot of advice and support, and they recommended that we do a staff survey to find out exactly what our issues were. We based our survey on how to take stock of mental health in your workplace, which is available on the Mind website. And the outcome was that about 1/3 of our staff said that they were not aware of what support was available to them. They weren't consulted, or that their views were not taken into account, and they weren't comfortable to discuss their mental health at work. Our line managers also said that they weren't confident in supporting their staff with mental health. And what really surprised us was that there was a big issue with perceptions. So the senior leadership team felt that there was plenty of support in place, but staff weren't aware of the support. Where staff were available, they felt they had to be seen to cope. They didn't feel comfortable to access the support. They didn't want to be seen to be weak. And while we did consult with staff and did listen to their opinions, their perception was that it was just a tick box exercise, and we weren't actually listening to them. So in order to address this, we started an information campaign using emails, a wellbeing notice board, and a wellbeing information file in the staff room to make all staff aware of the support available to them. We made a Time to Change employers pledge, which we shared during a full staff meeting, making a commitment to addressing staff wellbeing and mental health. We emphasized that it's okay to ask for help and to request support, and that it is okay to come to the office for a cry or a rant. We added a cover page to any further staff surveys, which lists the point raised by staff previously and the actions we take in response. So this very clearly demonstrates to the staff the impact that they've had and that they are being listened to. And to support our line managers, we offered them training as well as helping them signpost services. So even if they were not able to deal with the issue themselves, they could advise staff on how to get help and support. Now, there were a number of significant things that we put in place that worked really well for us. So we have a full-time school counsellor on the staff who's available for staff, pupils and families, and her input is really valuable. We did a lot of staff training. So we did the CHIP management program, mental health insets, and we trained up to mental health first aiders. We also have access to the employee assistance program through our parent charity. Whenever possible, we accommodate requests for flexible working or part-time working. We would rather have a member of staff in school for 3 or 4 days when they're in a good place and working well than for 5 days if they're feeling tired and stressed out. But even if you haven't got significant resources to commit to well-being, there are still a lot of little things you can do. And I've put little things in quotation marks because those little things actually make a big difference. The little things matter. And the main was just to ask staff, are you okay? And that's not a, hey, how are you? It's a genuine, how are you doing? How are things going for you at the moment? And then make sure you have time to listen to the answer. We put a wellbeing notice board in the staff room, as well as a thank you board to acknowledge staff's efforts. And the thank you board actually went through a bit of an evolution, where to start with it had some notices on it, and then more staff started using it to thank each other for the support they were giving each other. And then the use of it tailed off again. And staff said to us, actually, I'd rather say thank you in person. And no, we no longer have a thank you board in the staff room, but staff do still make a point of saying thank you to each other and acknowledge the help and support they give each other. We let staff finish early sometimes, especially if it's been a tough week. We let them take non-contact time at home so that they know they won't be disturbed during that time. In an ideal world, we'd have a dedicated space for staff to take time out. But we're only a small school, we haven't got space for that. However, we have said to staff, you don't need to go and cry in the toilets. Come up to any of the offices, we have tissues, we have biscuits, we'll make you a cup of tea. We're happy to sit and listen. And if you do want the space to yourself, just say and we're happy to leave you to it. We have a sweetie tin at the front of school, or rather we don't at the moment because of COVID. But what we did do is, at the end of the day, once all the pupils had gone, our secretary puts a little sweetie tin out on the reception, and staff come up, pick up a sweet, have a brief chat about the day, and it's just a really nice way to finish the day. We put a radio in the staff room so staff can listen to music during their breaks. And we're also very conscious that the senior leadership team set a tone for the school. So if as a senior leader, you say that I spent all weekend working, I'm really tired, I'm really stressed out, that kind of implies that this is what happens in your school and what you expect from staff. So while you do need to be honest and transparent about issues, if you seem to have a positive attitude towards addressing things, if you seem to have some sort of work-life balance for yourself, that empowers your staff to do the same. Now, these are things that work for us. They might not work for you. Every school is different. Every staff team is different. So talk to your staff to see what you think will work for them. And also be aware that things do change, like with our thank you board. Last year's successful wellbeing initiative might no longer work this year. We did a follow-up survey at the end of the wellbeing project and found that a lot more staff felt listened to, felt supported, and were comfortable to talk about their mental health. We were so pleased with the impact of the Wellbeing Project that we decided to sign up for the Wellbeing Award for Schools. As part of this, we extended our wellbeing team to include a parent and an external advisor. And we also looked outwards to make links with other schools and join other networks to support our wellbeing. And when we were assessed for the report, the assessor noted that wellbeing has become part of everything we do. It's not just a separate thing, it's become part of the school culture. We carried out another set of surveys as part of our work on the award. The initial survey showed that the majority of staff were happy with their communications, but we didn't always reach all the teams. And while most staff were comfortable to talk about their mental health, there was still an issue with line managers not being confident in addressing issues. As part of our work towards the award, we reviewed a lot of our policies and procedures to incorporate wellbeing. So, for example, our induction program now includes wellbeing, so that staff know right from the start what support they can access. And whenever we introduce a new procedure, we do consider wellbeing. How will this affect the staff? How will this affect workload? Is it okay for us to introduce this in this way, or will it have a big impact? We reviewed our aims and ethos to make sure that wellbeing is central to everything we do. We offered further staff training, and we also introduced counselling supervision for our safeguarding leads and for staff who carried tutorials. And in the follow-up survey to that, staff praised the communications they were receiving and the training they'd had. We no longer do a separate wellbeing survey, but we do include staff wellbeing as part of our annual school development planning survey. So this shows that wellbeing is now part of the overall school approaches. It's one less piece of paper for staff to fill in, and the replies we get do inform our school development planning. And the responses we got to last year's survey It did show the vast majority of staff were happy with the way their well-being was being supported. There were a few issues we encountered when we did our well-being work. So when we first started looking at resources, we noticed that there was a big emphasis on the employer making adjustments. We were concerned that staff might request too many adjustments that would not be workable for us as a school. We also did not want well-being to be perceived as something that was provided by management and used and consumed by staff. We felt that it should be everyone's responsibility, just as with any other health and safety matter. We therefore emphasised that every member of staff should be responsible for looking after their own well-being, and we will provide the tools and support to assist with this. When we first encouraged staff to raise issues that affect their well-being, we found that anything and everything was passed to the well-being team to manage, because anything can affect well-being. However, staff were now asking the team for help with anything from rotas to report writing to classroom flooring. So we had to set a clear remit as to what the well-being team should deal with, and remind staff that while we do want them to raise any and all issues, they need to be taken to the member of staff who can actually address this issue. And when you do a well-being survey, all responses should be anonymous and come to you directly and confidentially, so that staff are able to voice their opinions freely. However, when talking about well-being in a more public forum, such as a staff meeting, we found that negative questions, such as asking staff about problems, lead to negative responses, and staff may start to raise unrelated issues that you're not able to do anything about. Phrasing questions positively, such as asking what is working well to support your well-being, lead to positive responses, giving staff new ideas and making them feel more motivated and inspired, and ultimately leave them feeling more positive. Overall, I found well-being to be a very careful balancing act. An initiative intended to support staff, but that does not reach everyone, can make some staff feel left out and demotivated, which can then in turn spread negativity to other staff. It's important to always think about how a communication initiative could be perceived by everyone, including staff in different roles, to ensure it has an overall positive effect. The good news is that there's a lot of help and support available out there. The Anna Freud Centre obviously has got the Schools in Mind network and resources such as the 10 Steps Towards School Staff Wellbeing. Time to Change we found really helpful, and they're still around until the end of March this year. In our local area, we have a Council for Voluntary Service. I don't know whether you all have one in yours. If you do get in touch with them. They give us a lot of support. They run free staff training sessions for us. They have a wellbeing network that we got involved in. And they also had a wellbeing grant that funded some of our work. Education support were part of the talk just before. Mind have a lot of resources on their website. And there may be other networks in your area or for your type of school that you can get involved in. So you can get a lot of training, resources, advice and support, and all of this is completely free. So what difference did it all make to us? Our staff absences due to work-related stress have reduced significantly. And I haven't included last year's figures because last year was such a different situation that the figures aren't really comparative. Staff are in a better frame of mind overall, which means pupils are better supported, and staff are able to act as good role models for addressing mental health and talking about mental health. Our annual school development planning questionnaire, we now get a lot more replies, and they're a lot more constructive because staff know that they are being listened to. The links we've formed and networks we've joined have given us more useful context in other areas and access to additional resources. Ofsted now ask about wellbeing and want to see wellbeing being supported. It's increased the reputation of the school, and because we have a good reputation locally, it's improved our recruitment. We usually get a very good response to job efforts now because people want to work at Peterhouse. And it's just made the school a better place to learn and work overall for everyone. And just to illustrate that, these are some of the comments from our initial staff survey when we started to look at wellbeing. And these are some of the comments from our last survey. This was in July 2020, so this was actually during COVID. So just to summarize, find out what the issues for your specific staff team are, and a survey is a great way to do that. There's a lot of help and support available. Find out what will work in your context. Keep reviewing things because things do change, and talk to other schools because there are a lot of great ideas and great work out there. Thank you for listening. I'll pass you back to Peter.
And thank you very much, Conny, for an incredibly illuminating talk, and one that actually illustrated many of the points that Sinead had made in a very vivid way. We see these seminars as a collaboration, bringing together research and practice so that each one can inform the other. So it's inspiring to see the impact that innovative practice on staff well-being can have for the whole school. One thing that struck me is how this kind of systemic change can be achieved over time and can be built on, and how small actions build to make a large change, but also how measuring change over time is so very important to our learning. So thank you so much, and I look forward to more questions about this. But let me now introduce Lesley French, and that's a very special pleasure for me. Lesley has worked as clinical director of Children's Directorate of Oxley's NHS Foundation Trust, and as a clinical psychologist with quite a few years of experience in the National Health Service. I will not reveal the number, but she has focused in that time on evidencing outcomes for children and also their families throughout an important career, exploring the ways of integrating services for families. She has been a lecturer for the Anna Freud Center, teaching on the Children and Young People's Improving Access to Psychological Therapies leadership program. And she's now heading up TriSpace, our school's remote therapy service, which is a pilot program providing national remote support for schools. She's going to talk to us about some therapeutic principles based around applying mentalization techniques in schools to support school staff, pupils, and parents together. Lesley, over to you.
Thank you very much, Peter. That's a very kind introduction. So I just really wanted to pick up on some of the themes already introduced this afternoon, and just going back to some very basic principles we might want to apply using some knowledge around mental health and psychological well-being. And I just wanted to introduce you, for those of you who aren't aware of the model called mentalization, because it's going to be linked to an offer I'm going to make just toward the end of my presentation this afternoon. And I'm not going to spend a lot of time on it this evening, but just to give you some slides that orient you to this model. And the reason I want to do this is because this is one of the principles behind the remote delivery of a new service to schools that we are currently piloting. And we want to introduce the concept of reflective space, which is not a new concept, but there are particular ways in which this can be helpfully applied. So when we think about mentalization, it's a way of trying to think about people from their point of view, from other people's point of view, and it can give us some insights into all sorts of what can be quite confusing behaviours, both in ourselves and also within our own school community amongst students. And if we just look at this image of an iceberg, I just want to show you that what we can see on the beginning of this image is obviously the iceberg, and in this metaphor this becomes behaviour. So what we can see in terms of both our own behaviour and other people around us, but underneath that there are many drivers and concepts that are influencing what is visible that we might not so easily or readily access. And these might be linked to feelings, it might be to do with other experiences or thoughts, it might be linked to something somebody is trying to do that isn't always clear by the actual behaviour, or linked to a need, and sometimes and very often linked to worries and concerns. And sometimes children in particular can have very confusing behaviours that look like the opposite of what they're trying to achieve or hope to achieve. So in this, we can see that everybody really can have the skills to begin this kind of sleuth work, if you like. And other kind of models that relate to this are things called theory of mind, where we are constantly trying to think from other people's perspective what might be going on. And as both Conny and Sinead have already referred to this evening, we're not in an isolated environment. Schools are hugely part of a community. And what I really wanted to talk about this evening is how we can create those conditions in the school environment and really reflect some of the wonderful work Conny's just been describing, actually. And some of the mentalization techniques and principles are really about thinking, helping people to think rather than react, and trying to stay calm, which we call in psychological thinking being emotionally regulated. But most importantly, and I think for teachers, we must have a feeling of being understood before we can hope to understand other people. And I was interested in some of the information that Sinead was reporting on in terms of people leaving services or schools, which is around the feeling of being valued. And this can be a really good example of how a person might be very valued, but something in the communication isn't reaching that person. And obviously then with disastrous consequences for staff attrition. And as Sinead was talking about, this is a community of relationships, and these are exactly the sorts of links we want to be focusing on. And we think we've already emphasised the issues around community and networks. Nobody is working in isolation. And part of the work around mentalising is looking at all of those dimensions on the network in front of you on the slide. Now, in particular, we're thinking about staff and teachers today, but there's been lots of work done directly with students and directly with teams and staff teams using mentalisation principles. And as has already been touched on this evening, there are, I think, some very special factors which makes it very hard to ask for help. And when I'm talking about asking for help, I'm talking about staff, whether they're junior in the school or school leads, because there is something in the school communities which is absolutely hardwired about helping others and delivering interventions. And also, we need to know when to ask for help. And I say that, although it can sound like a truism, because it does take some thoughtfulness to know when one actually needs help and what is the normal functioning for oneself, and when actually something needs to be different in order to help you or another person around you to cope. And so it's critically important that the sources of help are somehow available and obvious, but are really, I think, very highly specific to people's environment. So I just wanted now to talk to you a little bit about the new pilot that we are running from the Anna Freud. It's been, we've started off as a remote service, so we've called it the school's remote service, but our naming is shortly to become Tri-Space. This pilot was a response to the pandemic. Now, I know that for some time, the Anna Freud has really wanted to expand its in-reach nationally. As you know, Schools in Mind have an enormous network, and this pilot is about providing some direct work within schools across the country, all delivered remotely. And I probably don't need to tell this audience, there is still a very big gap in the need in child mental health and wellbeing and national provision. In other words, how many children would benefit from some time-limited assistance for difficulties which are getting in the way of their learning, but they cannot get on the rung of the ladder of any help that is sufficiently geared toward them. So we've been running a pilot since September. So the initiative really, as I said, arose out of the pandemic, and we mobilized by September. And as you know, at that point, it feels a long time ago now, interestingly, schools had just returned after the summer. And I'm very sorry that we are now back in a position which feels, again, very similar to you all since that period. We reached out for the initiative using the Schools in Mind network, and although I'm talking with you today around teacher wellbeing, I did want to just say something very briefly, that this is several modalities we're offering. One is a peer support training, which is for older students, which is really utilising the knowledge gained from the DFE funded pilot for peer support, and we've also put some mentalisation work in there for young people, and that's a 3-session training model that schools have taken up. We are running reflective parent groups. These are reflective spaces for parents. We had originally started running workshops really just to allow parents to come in who've been obviously isolating and running homeschooling for very many months. And those really did have some value. We're moving toward a more structured group this term, which we are offering to parents of all secondary schools involved in our pilot. And this is, again, creating a reflective space for people to be thinking about managing their children and managing their children's learning, and in this current crisis that we are all in. This term, we are piloting some low intensity intervention work with young people. For those of you familiar with the EMHP program and MHST sites, this is for children who are generally have some issues around low mood, anxiety, which is interfering with their learning, that would benefit from evidence-based work. And we're piloting that now. And then finally, from the beginning, we wanted to offer something to staff. And although I'm in the company of absolute experts on this panel, and we know there's a need out there, the driver for this particular initiative came from consultation with our young champions, so young people who support the centre in designing interventions. And it was very interesting to me that many of those young people talked about worries about how the teachers would manage, also how they would themselves manage, and how the teachers would perceive them, but worries about how teachers would manage all the demands upon them. And that is what really triggered the work. And we know that for every teacher helped, whatever model people are using, if that teacher is active in a classroom, a large number of students are actually indirectly supported. And as I said, young people generated this idea, and this was very enthusiastically supported by the schoolies who are supporting this early pilot that we're currently running. And we badged it for staff that it was a reflective space to bring personal concerns and stresses, really which are impacting their ability to manage their working life and their responsibilities to students. And also to offer them the opportunity, which is a more traditional schools outreach model, to bring concerns about any student. And interestingly, all the calls taken have been related into teacher stresses and wellbeing. So teachers checking out how they are doing. And I think that is a small finding in itself. We've talked a lot across the term about how we felt that teaching staff were very much the forgotten front line in the pandemic, and this is an illustration. It is based on a real call. It's obviously amended for confidentiality reasons, and I won't read it. But the issues here were very characteristic of all the calls that we received, which is some quite senior staff had worked all through the summer, getting the schools ready for return, and then facing the most enormous amount of stress. And what's interesting is that actually those colleagues we spoke to, very up for managing, but actually it was a bit like the iceberg, you know, there's sort of a tipping point where actually pre-existing issues really came to the fore, and then just not knowing what the kind of call was around asking for help. And again, it picks up on a point that Sinead raised about the reluctance for teaching staff to admit there are difficulties without feeling somehow this is seen as weakness, but also very real concerns about confidentiality, and in the same breath in worrying that their own performance will be judged. And the schools that get this culture right, this, as Conny was saying, it's all about leadership. It's all about the ethos in the school. And the interesting thing about this member of staff is that she previously had a lead who was in fact not the most empathic of colleagues. the new lead, which is again a colleague working with us there, was extremely empathic and wanting to do the right thing for staff, and in fact enabled the call. The call really is a one-off reflective space using our mentalisation techniques and knowledge, really helping members of staff to try really and get a plan together. It's not digging around all sorts of other issues. It's around what are the pressing issues now and what's needed, and then we offer a follow-up call. And as you can see, this is early days for us, so I'm not making great claims yet about efficacy. We've got a small reach, but these are some of the early feedback comments that we've got. We're trying to be very responsive, and also this is partly learning that when people ask for help, they need it. So we haven't been running sessions in the sense of it. People have to call on a Tuesday. We've been booking sessions in as teachers can make themselves available. So one offer we are considering now is to just make a small expansion to that offer. Again, really holding in mind the needs for teachers, for teaching staff and for leads. So we're just going to offer some pilot workshops really based on mentalisation principles, but really thinking about teacher wellbeing and strengthening resilience. We come at this work completely acknowledging the professional status of teachers. This is a very delicate line, actually, in recognising people's expertise, but also people also being in a helping role and that interface. And it's a really sensitive relationship to manage. And we also recognise there are multiple responsibilities on every member of staff in front of us. So the aim is to strengthen resilience, and in particular, building on this relational model to really help those conversations between staff, so that it's not going to an expert, it's using some expertise to infuse, if you like, a culture of help within the school community. And obviously, as both Sinead and Conny said, this is a really important issue around leadership and the culture set within the school. And I think we can't talk about any of these issues without acknowledging there is significant emotional impact of the work in schools at this time. This is not a typical school year, and most school years have their own stresses. And I think it's reasonable to kind of point out that for all staff need to be reflecting on those days when actually things feel absolutely insurmountable, and the next day for some reason they feel slightly better. And some of the mentalisation work is to help to mobilise that resilience that everybody has. So finally, I've just put some dates up here for your reference. We will be sending out some registration through a booking page, but I thought for those of you who may want to take this offer up, we are going to try and keep the workshops small, meaning around 20 members of staff. We will obviously have a look at the volume of interest and recalibrate that as we need to, but that is the current offer. So thank you very much. I'll just hand back to Peter.
Thank you. Thank you so much, Lesley. And that's a nice specific example, and lots of questions about how people can join TriSpace. Your message has been heard. I wonder if you could have all the panelists up in a wonderful, who is the odd one out? Who doesn't have hair in this? Sorry, a personal concern. Right, let me make sure that everyone knows who Jamie is. Jamie Smith, who is the director of our division of schools, who is in charge really of all this. And I'm a mere puppet being operated by invisible string. By Jamie. We have loads of questions, more questions than probably we'll have time to answer. So please try and be brief if you can. One very brief one for Sinead. Can you repeat the education support helpline number? Do you know it by heart?
I do, and I've just posted it in the chat. Hopefully attendees can see it there, but it's 08000 562 561.
Yeah, let me repeat that. That's 08000 562 561. I've passed. Thanks, Sinead. That's reassuring. Okay, now the next question, the subsequent questions are more difficult. One question that came up a number of times, really, let me just turn to Conny, but actually it's really for everyone. How do you design, how do you kind of, what are the handy hints for doing a well-being survey? If people want to do a well-being survey. So,
the one I used as a basis for mine was based on the How to Take Stock of Mental Health in Your Workplace, which is a resource available on the Mind website.
It's the Mind website you want to direct us to. Jamie, do you want to any further directions?
I'm also happy to send you the initial survey that I did if you're to send it out with the notes from the seminar.
Okay, that I think would be something that people would very much like.
Yep,
Jamie?
I'll send you that.
Thanks, Connie. Yeah, I would just add that we've got lots of resources on our website, so people absolutely don't have to start from scratch for this. We have validated tools that people can use for free. So one of the 5 steps, as people will know, is understanding needs, which we did our last seminar on, which is all about measurement and how you measure well-being for children and young people, but also for staff. So if people go to that step on our website, there's a whole load of information completely free about how to design a survey. There's some short videos to watch about schools that have done that, and some people talking through how best to do it, and some validated tools that you can use completely for free from Cork. So Cork are the Child Outcome Research Consortium. They're part of the Anna Freud Centre, and there are links to all of their work on our pages. And it's really friendly advice of how to do these kind of surveys, how to get the feedback, how to analyse them, what you can do then to kind of embed them in your setting. So please don't start from scratch, because that's a huge amount of work, and we've done a lot of it for you. So please go there first and learn from others, and the great case studies, including ones from people like Conny, which will tell you what schools did and what went wrong and how to avoid that.
That's really, really helpful, Conny and Jamie, using plagiarism is just a way of complementing someone's creativity. Sinead, can I turn to you and ask a question that a couple of people asked? What's the role of governors in well-being? How can governors support teacher well-being?
This is a subject close to my heart as a governor myself, Peter.
I was seeing, I had to use my sight.
Tell. I think one of the most important things that governors can do is not get in the way of school staff right now. Actually, there's a lot of governance requirements that are a big demand on the time of school leaders. And so I think as governors, we have to exercise some discipline about what is most important and allow our school leaders to focus on, the stuff they're trying to focus on right now. Often as governors, we're very anxious to help, and actually sometimes we can create more work unnecessarily in our anxiety to be supportive. I think one of the big things governors can do is to recognize their leadership role. And for governors to recognize and appreciate staff is absolutely appropriate. I say the primary school I'm a governor of, we used some PTA money to buy a small gift, which was really about an acknowledgement for staff at Christmas. The gift was tiny, and we then hand wrote labels for every member of staff. The feedback from that was phenomenal. People felt acknowledged and appreciated in a week where they were dropping like flies with positive COVID tests. It doesn't take a lot for governors to actually reach in and provide support. So I think that's something that we should be doing. More broadly, looking outside of COVID though, I think when we talk about school surveys, staff surveys, I'm also a fan of there being a level of a gap between where the survey happens. So I think there's, it's important from time to time for governors to own the survey, for it not to be done by management, because if the data is held by management, it's very difficult. Where it's fine when everything's grand, But when there's a problem, that doesn't work so well. And so I think for governors, sometimes, however periodically you organize it, to make sure that there is an opportunity to create that safe space for staff to say what they need to say and to know that it will be picked up is good practice.
Yeah, I think that point of independence is really important. Anything, I'd quite like to go to Lesley next, if I may. We might come back to some of this in other settings, but Lesley, a number of people want to know how to get involved in TriSpace. You obviously did something to sell it to people.
Well, we have been operating a pretty low profile small industry for the first term while we got our feet working remotely in this way. So I will pop an email contact in the chat in just a moment for our participants. And we are absolutely open to schools joining the pilot. It is a pilot. I'm stressing the word pilot. You don't have to sign up to all of the interventions I was describing. If you've got a particular interest in the teacher wellbeing offer, we would be absolutely thrilled to support you. The criteria up until about Tuesday were areas affected, high need areas affected by COVID. This now appears to be the whole country. So, but we are very keen in particular to work out of London, obviously nationally across the piece. So I'll pop in an email now. In terms of the workshop I mentioned, Peter, will open a booking page for that shortly, which will again circulate. Thank you.
Thanks. I might come back to you for another question, but before I want to address a question to the whole panel, and again, whoever wants to take it first can take it first. It came up in two different contexts. You know, someone might have plans, you know, a head teacher, a senior teacher might have plans, but how do you engage staff in a wellbeing program? You know, it's a kind of horse to water kind of question. How can you convince people to take well-being seriously rather than a kind of a tick box exercise? Sinead, you start.
I'm going to start because I'm surrounded by psychologists, so I need to get in quickly, you know, before they say really sensible things. I think role modeling is really important here. I've learned this myself. I've never disclosed so much personally as I have since I joined this organization because of the work that we do. And it's really interesting. You can tell people to take it seriously, but unless you are willing to make yourself to some degree vulnerable, and there's an appropriateness to that, you clearly cannot share the entire back of the tapestry because that would not be appropriate. But there is a degree of role modeling I think that we need to do as leaders or as the people who are encouraging others to take this seriously. So I think giving people good evidence, and the literature is saturated with good evidence about the value of self-kindness, self-compassion, self-care, and then role modeling and making sure that there is always a protection. So there is never a negative consequence for somebody who comes and shares something in this space, that would never be used. You have to work quite hard sometimes with line managers to secure that. But for me, I think those are the things that are most important practically.
Jamie, Connie?
Yeah. There's no point in making plans as a manager if you haven't involved staff in those plans. So we formed a team with different staff from different parts of the school to make sure that we didn't just put something in place that actually was meaningless or possibly even a hindrance to them. We spoke to staff and say, what would help you? What are your issues? Because you can't make those plans without knowing what staff actually need and what actually means something to them.
So engagement should start with self-disclosure and then also with curiosity about need. Jamie?
Yeah, I would completely echo that. I mean, first of all, talk to your staff, make it part of the conversation, make it really part of your school culture. There's a really nice example of a school that we work with, and there's a case study on our website about how they wanted to start that conversation, and they chose to make a huge display in the centre of their school. They're a big secondary school in Sheffield, and they got every member of staff to take a photo of themselves, which was about how they look after their well-being. And so there was this big display of teachers saying, this is what I do to look after my well-being. And it created a conversation across the school, which engaged pupils and teachers and everyone to start thinking about, how do I look after my well-being? And it started the conversation. So I think we have to really open that up and change the culture of schools where we're all talking about well-being and how we take care of it and how important it is. And thinking about it in the same way we think about our physical health. And I think there's lots of little ways to start that ball rolling, but I really like that example.
I like it too. But one thing that came up in both your talks, Conny and Sinead, that I just want to alight on, and that's the importance of line managers. And a question that came up is, all very well, but how do I get my line manager to change? Is there an elixir? Is there a training program for line managers that we could apply that would bring about a positive change?
Oh, for the little blue pill that we could give to all line managers, myself included, that would make us better. I am not aware of a specific line management program at scale for schools. Schools often struggle with standard line management because so much of line management in other organizations happens in a more structured way. It's very difficult in a school where you snatches moments of time with people between classes in a secondary school to connect and make a point, and not the same kind of structures in place often that exist elsewhere. So I'm sorry to say I'm not aware of one. I know that there's great training available from organizations like Mind on mental health for line managers. CIPD do good training on line management. There's all sorts of kind of more general pieces out there that probably are relevant, but perhaps it's something that we need to look at again in the education sector.
Thanks. Conny, Jamie, do you want to add anything?
No, we have looked at specific line management training for education, and I've not found anything that's actually specific to education. There's a lot of general training, but I haven't come across anything specific.
Yeah, same.
So something for Jamie for you to develop, clearly. I've got two questions for you, Lesley, if I may, just very quickly. One is a challenging one. It's all very well to have reflective parent groups, but it sounds very middle class. The question is, well, I work with disadvantaged parents. It sounds very highbrow. How accessible is it?
Yes, I think it's just a really valid point, and I'm really sensitized and sensitive to those issues. We started the pilot running workshops, and actually what's been interesting to us is the parents that stayed with us have been, for example, parents of children with specialist need, parents who are actually quite isolated. And so there's obviously something we're doing right about holding on to parents who aren't accessing what we might consider more well-resourced kind of channels of support. Now, I think what we are piloting this term, Peter, in terms of these reflective groups, is to see how accessible they are. It does sound very highbrow, and some of the language can be very off-putting. And obviously we're not kind of communicating out in exactly the same way when we're talking about this to parents directly via schools. But the idea is that it's more of a course that people can sign up to. We're badging it this term around managing adolescent emotions because there's some feedback we had. And the links are then around what that raises in parents and how they can use each other in a very much actually a peer support model. But I think the proof will be in the pudding, actually, about those outcomes. But I'm very sensitized to issues around accessibility.
And I think you were also asked for a reference on mentalization.
I was going to put that back to you, Peter, since you've written the vast bulk of the resources, but we can put something, we'll put something out. I think I'd just like to have a little bit of a think about that because it needs to be obviously accessible. I'd like to think about something that maybe has some particular resonance for staff.
Okay, I think there's a lot of interest in TriSpace, so do try and address to capture that. But I want to, may have time for more questions, but just in case there aren't, there's one very big question, which I am certainly very taken by, which is that what is highlighted by the presentations to some degree, particularly Sinead's presentation, is that there are fundamental changes that schools might need. Can the panel suggest issues that are fundamental, that would represent fundamental change that we could go to government with, that would make schools work differently, that would be, from the point of view of mental health of staff, the well-being of staff, more beneficial, and therefore more beneficial for the children and young people that they are engaged in. Anyone who wants to take up the challenge. I mean, don't this time, you know, really big ideas. Yeah, Sinead, again, I didn't have to look very far.
I would say, I mean, I think this point about, this is where I think we come back to, I bang on, Peter, you've heard me talk about it before, the interaction between the different levels of the system. And I think there are fantastic schools out there doing the very best of what can be done within the current system. But actually, if we want fundamental change, we need to look at the policy environment. And what we have in the education sector is actually quite a harsh policy environment. You know, it's one of no mistakes. There is no capacity, there is not an inch of capacity for anything to go wrong. There is no tolerance for an experiment that doesn't yield a fantastic outcome. There is no time given to schools as organizations that need to improve and to implement change over time. There just isn't, it's not available. And there, you know, there is a, at the same time as there is an increase in requirement, there is a lessening of resources in real terms. So for me, those are the structural issues that need to be addressed in order to allow school leaders, many of whom are brilliant and have great ideas for improving what they could do. But until that policy environment stops providing so many constraints, they will struggle to do it, I think, beyond the best of what can be done by the, you know, the most creative people.
Okay, Jamie?
Yeah, so I mean, I think I really hope to see that the government continue to implement the Green Paper initiatives. I think the fact that schools need to have a senior mental health lead is really vital. And those senior mental health need training, proper training, in-depth training about how to be a senior mental health lead and what that involves and what the requirements are. So, you know, that is something that the government have said is going to be a requirement for schools. I'd like it to be mandatory. I think that's quite important. And I think those leads need support. I guess what I would say as a positive is we did see DfE convene an expert advisory group around staff wellbeing, which Peter and Sinead, you were both on. And we did see that group have a number of recommendations, which the government have stood by and are intending to implement those recommendations. And we do hope to see, as a result of that, the implementation of those. So, for example, the Wellbeing Charter, some agreement for DfE to measure staff wellbeing, to think about staff wellbeing resources and making these more accessible and thinking about workload policy. And so I am encouraged by that. I'm encouraged by the conversations and the fact that the expert advisory panel existed and that people that were on it were brilliant. And I'm sure Peter and Sinead, you might want to say more about that, but that does feel encouraging.
Thanks. Conny, do you have any thoughts that, or Lesley, do you want to, any thoughts on that? Big ideas?
Nothing that Sinead or Jamie haven't already said. I think just it's quite a harsh environment working in education at the moment. A lot of things get given us a very short notice. A lot of things are very short term from the government, and we're not allowed to do things long term because they're very much planning in the short term.
Yes, I promised myself I'd refrain from any commentary. One idea that I've heard, Sinead, you, and I'm surprised you mentioned it, is the importance of supervision as because social work, psychology, medicine, I have never worked, even at my ripe old age, without supervision of some kind or another. And yet my colleagues in education are flying these you know, small aircraft on their own without a co-pilot, or, you know, they're in the room on their own with 30 kids. Is there any room for supervision?
I think there is, and I think there are different elements of supervision, of course, that come into play there as well. There'll be, you know, there are, one of the limits of line management when it doesn't work well, you know, there's a kind of fundamental professional piece of supervision. There are, in schools, there are some who would look for clinical supervision because of the nature of the work that they do. And at Education Support, we've been piloting something that's a bit of a fudge probably, we've called personal professional supervision, but specifically looking at the personal impact of the professional role on the individual. And for a lot of professionals who would not consider counselling or therapy, this is a very defined way to look at the emotional impact on them. So we're piloting that currently, as well as piloting online, something we've done face-to-face for years, but piloting online facilitated peer support, which actually has been incredibly successful online. And we're now looking at, you know, again, we come back against the issue of resource constraint in the sector, the number of schools that are crashing into, you know, not being able to function because of the costs incurred by supply teaching in this year. So we need to find free and easy things that schools can do. We're looking at developing something around supporting, you know, peer support without the facilitator. I think we would all agree this is going to be a less powerful offer, but better perhaps than nothing, which might be the alternative. So I think we need to have a range of supervision offers and clarify for people, you know, what's appropriate in what circumstance, whilst we lobby, and certainly I will be lobbying for resourcing for this. And to Jamie's point about the designated mental health leads, you know, that's clearly going to require, you know, really proper support.
Jamie?
Yeah, I just wanted to jump in about the supervision, because absolutely, I was a teacher in the secondary school, and you're absolutely right, Peter, it's very isolating. You're in a classroom all day on your own. You're teaching on your own. You're often having conversations with parents that can sometimes be quite difficult on your own. And if you're dealing with safeguarding, then you're dealing with very challenging things that you would then kind of take home with you. I think the thing about supervision is that it's extremely expensive and schools have got no money. So what we've thought about here at the Anna Freud Centre is how can schools, for example, and Lesley is an expert on this, how can we think more about kind of work discussion groups or reflective spaces that schools can do themselves, which gives that position where you can come to that group and you can process and reflect and talk about something that's happened in your day or your week with a child, with a parent, and just share that with your colleagues and gain support from others, and to collectively think about issues and think about how you might solve them and what you might do differently, and learn from your colleagues, and really have that space where you can talk and have some empathetic conversations and feel supported and not so isolated, and feel that you're not being judged, and it's a place that you can process together. Because as teachers, we don't have that. You don't have that. You might do it on Friday night in the pub, but that's not quite the same. So I think we need to have those spaces, and they need to be encouraged and championed in schools. And yes, there's still a cost attached, and but you can have a senior leader. You can rotate who manages those, and it's much more of a peer support space. And it means that you can kind of think more holistically and support each other. And Lesley, I mean, you're an expert on this, but I think this is something that schools could do themselves.
Lesley, final word?
All I would just say, Peter, and to Jamie, really, is there's just something here about linking it back to obviously to the wellbeing agenda, that I think those low scores that Sinead was talking about have an absolute relationship to the kind of the way in which teachers feel supported in schools. So I just think it's a key strand, that's all.
Okay, well, listen, I'm a terrible chair that I am. I'm 5 minutes over already. I'm really, really sorry and apologize. Fantastic panel. Conny, Sinead, Lesley, Jamie, thank you so very much on everyone's behalf. And if there is kind of one conclusion that I came away with, is really the importance of one point that Sinead mentioned very early on. Agency, that actually creating opportunities for people to be able to do things for themselves in a way that both they feel supportive and they are supporting others in creating a communication, a network, where they can say thank you, to follow Connie's example, without having to stick it on a notice board. But for want of a better, I want to stick my thank you to the 4 of you on the particular Anna Freud Center notice board. So thank you very, very much for your contribution. And thank you for you listening. There is you'll be passed a feedback sheet, which I would obviously like you to fill out, and I would hope that you will join us next time. We really appreciate you attending. So thank you, and again, apologies that I run over. Bye-bye.